Hi, Ruth Nemire for the American Association of Colleges of Pharmacy. And it's really been an honor to be a part of the planning committee and to be here. Neurology has really been my practice for most of my years. But I will tell a story that when I was doing my PharmD training, the physician who actually probably taught me the most and helped me become the most empathetic pharmacist that I could be was the oncologist. So I always count him highly among the people who I carry with me. I think there are 5 things that I just really wanted to reiterate. All of them have come up over the last couple of days, but education, practice, the generations in technology, human skills, and dignity. And education, we really need to make sure that we are including from very early on the PAs in their early years, the P1s, the M1s, the D1s, all of them, and getting them involved as navigators. There are lots of ways to include them in the system as we rethink the care force. And I encourage all of you to consider that as you set up new practices, as you're the directors, as you are in the communities there. All of the schools of colleges of pharmacy are and all of the schools of health professions are required to have interprofessional education. They are all required to have, and they shouldn't do it just because it's required, but it is a kind of an incentive for the faculty. So they all have those things. They all have community things that they need to do, and much of what we've talked about over the last day and a half really could involve many of those students, and it gives them some of those human skills that they really need. In practice, if somebody did an algorithm, and there are 3,700, by 2020, there'll be about 3,700 board-certified oncology pharmacists. They equated that to about 3 to 5 million half-hour visits. So there is a lot of ways to get the pharmacists involved. And oncology has been very good about having pharmacy as part of the team, but I think there are other ways to do that. And then as you think about the survivorship, there are 3,800 board-certified ambulatory care pharmacists who can be following those individuals who have survived and are not in active treatment. They can be transitioned very well from the oncology pharmacist to the ambulatory care pharmacist. And then generations in technology, I would say that for the next 40 or 50 years, we have a lot of different generations with expectations because people are living longer, number one, anyways, because now they are surviving, and because you've got caregivers who are of several different generations. And so there's all of these expectations that are going to be of the care force, and we need to think about those. We've talked a lot about technology, and there will be care force members, and there will be other faculty and other just general population who says, oh, but technology, I'm going to lose my job. So I want to reiterate that it's the human skills that will be valued. It's the communication skills, the creativity, the problem solving, the ethics, the team. Those are the skills that will be valued in the future because technology will do and make things more efficient. But if we as the care force bring those things to the care force, that's what will be valued. That's what will become a part of the system and that payment model that we still talk about. And then I guess finally, my last thing as a faculty member, as a team colleague member, as a caregiver, as a patient, is that I think one of the things that has to be at the forefront of our care force is that dignity and respect. And that we need to treat each other with dignity and respect. We need to treat our residents and fellows and learners with dignity and respect, and sometimes that doesn't happen. And then we need to have that dignity and respect for the caregiver, the patient, that part of the team, and that includes that dignity and respect at the end of life, and for those end-of-life choices that people make, because I think sometimes we leave that out, and firsthand, if you don't do what physicians or team members tell you what they think you ought to do, it feels like that dignity is lost. And so I would just encourage us as a care force to make sure we keep that in hand.